So today is a great day. It really is to have a healthcare town hall here. I think it's amazing to have people here that are leaders in that department. I think is absolutely fabulous. So, but before I begin, I'd like to acknowledge that we're in Mi'kmaq, the traditional land of Mi'kmaq people. I also want to acknowledge that the people of African descent have shaped this province for over 400 years. I'm so pleased to be here to be part of this evening's conversation with all of you and some of our health leaders for this important discussion. I'm pleased to welcome a true friend, I can say. Right, Michelle? Michelle and I go back long before politics, so I can call her a true friend. So, Health and Wellness Minister Michelle Thompson and Nova Scotia Health Interim CEO Karen Oldfield, who's quickly becoming a good friend. Work friend. A work friend, true. And they'll provide an update on work underway and improve health system and answer your questions. I can tell you, I won't give all our secrets away, but I can tell you that there's a lot of change coming. There's a lot happening, and I'm very excited about it, to be honest with you. Health and Wellness Deputy Minister Jeannine Lagassé is here as well, and she can help this afternoon, or this evening, I should say, to address our questions. So thank you very much for coming out, guys. I'm looking forward to a lively debate, I hope. Anyway, with that, I'll pass it off to Michelle Thompson.
Thank you. Hi, everyone. Good evening. I'm really happy to be here in the homeland. For those of you that don't know me, I'm a Cape Bretoner, so it's nice to be able to get home, and I'm from Badek originally, Middle River. So we used to come down to Jacobson's once a month, I think on Nanny's payday, so that we could go and get new outfits. She was a teacher. So it's not unfamiliar territory for me here, so I'm really grateful to be here. So I'm a registered nurse. I've been a registered nurse about 30 years. And had a variety of different positions over that 30 years, and then was elected the first time in 2021. And I am the MLA for Antigonish, which is where I live and have raised a family, and then was appointed health minister. So that's quite an honor for me and a privilege, and I feel that as an MLA, and I feel that as a cabinet minister, but I also feel a responsibility to my former colleagues in healthcare, because I know healthcare is important to Nova Scotians, and I know it's important to them. And so really, it's a very important file for me. So shortly after we formed government, we went right out and we talked to healthcare workers across the province. We started in Neils Harbor, we went all the way to Yarmouth and in between, and we wanted to hear what healthcare workers were experiencing and what they felt the solutions would be in order for us to move through and address the issues in healthcare. So on the voices of those healthcare workers, we created a strategic plan called Action for Health, and it's got 6 pillars in it, and it's accompanied by a website that shows where our progress is, and also to be accountable to people, shows where we've yet to make or have not made the progress that we had hoped that we would, or we continue to try and make. So we want to be accountable. We know that there are a number of challenges in healthcare, not just here in Nova Scotia, but across the country. And tonight we want to share a little bit about the things we're doing, what we're planning, what we've been able to accomplish so far. We know there's lots of work to do, but we also want to hear solutions from you. And that's why we're out in the community. We have 18 stops on this tour, hearing from communities, trying to understand what works in one area, what works in Metro in Halifax is maybe not the solution for here, which is maybe not the solution in Canso, and so on. So it's really important that we hear directly from you. We do want to be solution focused, but we do also want to tell you a little bit about the work that we've been planning and the work that we've been doing. So I look forward to the discussion. My colleagues are here. We're here to answer your questions, and we're here to hear your ideas. And I look forward to the evening. So thanks very much for having us. So I think, Karen, it's you.
Always Jeannine.
Thank you, Minister. It is a real pleasure for us to be here tonight. We've done, as the Minister said, a number of these sessions so far. I think we're about halfway through with this evening. That we still have a few more to go. But we've really tried to keep it a conversation. So some questions have been posed in advance when you registered. We hope that you've gotten cards at the registration desk and that you will ask your question or put your hand up and someone can ask it on your behalf. But really, we're trying to have it as a conversation back and forth. So it isn't a question and answer format, but really want to hear from you. And as the Minister said, we're really interested in hearing your solutions, because often if you've identified an issue, that you've also identified something that you think could be a solution. So we're very interested in hearing that. Everything that we take away, there's not a afternoon or evening that hasn't gone by that we haven't had a conversation either right after or the next morning where we've learned something that we've been able to act upon or give to our staff to say, when you're working on something, please think about this. So please know that everything that we hear from you this evening will be taken back, and it is informing our work as we go forward. So thank you.
Good night. Good night. Good night. Hi. I was putting the cart before the horse, that's for sure. My name's Karen Oldfield. Pleasure to be here tonight. I want to start with two things. First of all, I'd like to, with a wave of hands, have all our frontline healthcare workers just give a little wave. She'll see who you are. And in the back too, all those people that were, there we go. So I want to start by saying thank you. Thank you for coming tonight. And thank you for what you're doing and for the work that you are and effort that you're putting in to keep Nova Scotians safe. As we've gone around the province on this tour, I do like to remind people that almost 3 years ago when the pandemic started, do you all remember when people were banging pots for the healthcare workers? When people were giving out Tim Hortons cards and flags were flying and our healthcare workers were our heroes. And somewhere along the way over the past 3 years, I don't know when, but that changed. And so I simply want to say again, thank you for what you do, and I ask people to be patient and kind when you interact with our healthcare workers, because they really need our support and our help. So with that, I'd like to introduce you to some of your team here in Cape Breton, in Eastern Zone. And I'd like to invite Brett and Dr. Dawn O'Brien and Michelle and Glenn, if they would come to the front. And what we thought we would do is allow this team to introduce themselves to you so that you know who they are and they can tell you a little bit about what they're doing here on the ground. And then we're going to dive into some questions. So I'll start with Brett, who's the Vice President of Operations here. And just briefly, Brett, say hi and what you're into. Thank you.
So thank you, Karen. Thanks for the introduction. Brett McDougall, I'm a registered nurse as well. I live in North Sydney, Georges River area, born and raised there, and been working in this area for probably the last 24 years. I'll allow Dawn and Michelle and Glenn to introduce themselves shortly, but just to give a brief overview in relation to some of the activity specific to the Glace Bay facility is really, obviously, as you know, it's part of the redevelopment. That work is still ongoing. It really is part of a larger system and a very important piece of the system. So our goal really is to maximize the facility. You can understand that it was one that was identified as a renovation. That was because the infrastructure was in good shape. So what we're looking to continue to do there is provide ambulatory surgical services at that facility, look to redevelop the emergency department. We have a large ophthalmology day program there in relation to access for the entire island. We also have a robust ambulatory care. We also have a long-term care facility, or unit within the facility itself, and quite a few medicine beds serviced by a hospice program, and Dawn can speak to that. So our goal really is to continue with the viability of the site, support the staff, the physicians, and all the team there, and so certainly willing to entertain any questions at any time about Glace Bay, but we're excited about the redevelopment and continuing to invest in that site. I'll pass it over to Dawn.
Thanks, Brett. My name is Don Bryan. I'm an orthopedic surgeon. I've been here in this community in Sydney, in this area, for 25 years now. I'm originally from Dartmouth, but I came here 25 years ago. My family grew up here, spent lots of time in this rink, and both kids played hockey, so they're very familiar. And as an orthopedic surgeon sitting in the stands, when someone would crash into the boards, all heads turned towards me, and I'd usually miss the rest of the game because I'd be down underground or taking someone to the Glace Bay Emergency Department. And I am intimately connected with the hospital here. I've been operating here for a number of years. It's a great hospital. We got a lot of work done here. I worked with the hospitalist service, some really hardworking physicians in the community. You know who they are, and they provided a really great support for us over the last 2 to 3 years because the Cape Breton Regional Hospital was just bursting at the seams, and we would provide the acute care, and then we would need to move these people out so we could provide more care for others. And it was, the physicians here in this community, they really stepped up. They accepted our care. They took some very sick people. They were taking care of them. They were stressed, but they really played an important part, and we're continually grateful for that. We have a great relationship with not only the hospitalists here, but the family doctors, and also the emergency department. As an orthopedic surgeon, I work closely with the emergency room physicians, and so there's always a lot of contact here. We realized what the important role this department had played, the problems when it was closed, the community. It had reverberations throughout the whole island when this place was closed. We realized the importance of it. With the redevelopment, we're really trying to find out what Glace Bay's role is, what this building, what this hospital can provide. So we're trying to find out what they can do most efficiently. They have the eye clinic there. They have a well-functioning hospital service. They have a well-functioning emergency department when we can staff it. So I think those are the main issues for this area. I'm the medical executive director of the zone, so it's the all Cape Breton and Antigonish and Guysborough Guysborough County. So my role is basically with the physicians. I'm kind of representing the physicians, the manpower that they can provide, the services that they can provide, what medical care models we can put in place. The physicians work very closely with everybody else, all the administrators, all the other leaders. We do not work on our own, and that's really one of the important things that we have discovered over the last 2 to 3 years is that we do when the physicians are working with all the other administrators and leaders here. That's the only way we're going to accomplish things. We tried working on things by ourselves in the past, and we realized it just wasn't working. So that's kind of my role here today, and so I'll introduce Michelle.
Good evening. My name is Michelle Podesta. I'm a new Cape Bretoner. I've been here for 2 years. My family and I moved from just outside of Vancouver. We really wanted a quieter life with our teenage children, so super proud to be here and being part of the healthcare community. I'm the executive director for acute health services and primary health care, so I have responsibility for emergency services, surgical services. One of the things that we've been working really hard lately in Glace Bay is reopening the Emerge. I know that's been a long time coming for this community, so happy to say that we've been successful in opening it 2 days a week. Our goal is certainly to continue to provide increased access and look at more days in the coming months as we can recruit more healthcare professionals. The other thing that I'd like to mention, which is a real proud, and I'm going to give a shout out to Ann Buchanan, who's one of our directors at the back of the room. Our medicine team has been working really hard on a safer bundle, which really is just increasing timely communication and discharge home. And we've been a pilot unit for the province, and that team has received some really great feedback and kudos over the last several months. So I just wanted to acknowledge Anne and her team and just some of the great work that's happening here in our community that's being championed across the province. So really nice to meet all of you, and look forward to the discussion this evening.
Good evening, everyone. My name is Glenn Cox. I'm a registered pharmacist by training. Born in Sydney, but have worked in Glace Bay both as a student and as a pharmacist in both at Shoppers Drug Mart, the old Carol's Pharmacy, as well as at Superstore. So know the community well, and actually worked at the Glace Bay General and the old community hospital. I know that goes back a long way. As Don said, last time I was in here, I was coaching hockey. I was coaching with the minors, actually, and coached against the minors. And I'm going to date myself, that I played hockey in the old minors form against St. Mike's High. So I know that goes back a ways. My role is the Executive Director for Community and Rural Health, so I actually look after and have oversight for a number of the community sites outside of industrial Cape Breton. But with that said, am responsible for lab, pharmacy, DI, rehab services, and palliative care for the zone. So having, obviously a role to play within the sites here to ensure that you're able to get your lab DI tests in a timely manner. So this team back here can make those decisions quicker and help you with your health care. I do want to say just that I know from both coaching in this community and actually coaching against this community, the strength this community has and the passion it has for the community, for your health care, and for the services that we need to provide to you, and that we're committed here as a team to ensure that we can provide those services and are here to listen today so we can help improve as well. So just want to thank you for this evening and an opportunity to chat. Thank you.
That's great. I really appreciate it, team, and I just want to, say to the community that Brett and Dawn, Michelle and Glenn, and their entire teams work really hard for Nova Scotians, and so I appreciate it and thank you. So Nancy, over to you.
All right, we're going to get started with some questions, and I'm just going to, a couple of kind of housekeeping items, I guess. Depending on how busy it is, we may or may not get to everyone's question tonight, but if we do not, if we do not get to your question, I would ask you to submit your card with a question and an email address on it, and someone will get back to you. We will do all our best to get as many questions as possible, and I always want to kind of start with, set the expectation from the beginning, just in case. So I think what I'm going to do to start is we have a couple of questions. So some people submitted questions beforehand. I'm just going to grab one. And just to kind of give the sense of, I think sometimes it gives us a little chance to get warmed up. But we get a question from someone who may be here, may not be here, but submitted questions. So when you registered, you had an opportunity to submit a question. And sometimes these are the really tough ones, so it's kind of fun to start with those and kind of see how they get answered. So the first question is, how will the Department of Health ensure that all stakeholders are at the table working collectively towards a goal of improving care and access to care for the people of Nova Scotia?
So I'll start, and they fill in all the gaps that I forget or the things I don't know as quickly or as readily as they do. So it's really important to us that we have as many stakeholders at the table. And so I'll just say that when we started, the day after we formed government, we implemented a new health leadership team. And so that health leadership team that makes decisions across the system are these two folks sitting next to me, and also include Kevin Orrell and also Janet Davidson. And so we're represented, the Nova Scotia Health Authority and the Department of Health and Wellness sit together on a weekly basis and make decisions for the entire system. And that sounds very smart. I think it's really smart, but it's never happened before in the history of the province. So before, Department of Health, as the policymaker and the funder, would kind of work, and Nova Scotia Health would work parallel. And well, yeah, to be generous, they would be parallel, but now they're at the table, and those things that have to happen in real time, and so making decisions in a more agile and a quicker way. So that's part of the system. It's also really important that we work with folks outside, and I know that the paramedics are represented here today by Kevin McMullen, so I'm happy to see him. He's not always happy to see me, and I'm not always happy to see him, but tonight we're best of pals, so it's great. But we need to work really closely with the folks in our EHS system. We need to work with the company. We, as Department of Health, are the regulator, and we have the union that represents paramedics. We know there's a ton of work to do in our paramedics in the system in order to improve their work-life balance and to, attract people to the profession. So we sit, or I don't, but the folks that are working sit at a table together for the first time, and it's good to have those tough conversations, and it's good to find solutions from the front lines. At the Nova Scotia Health level, we're trying to reach into communities to understand. We know there's a ton of work to do. And it's going to be all hands on deck. This isn't just my job. It's not just Jeannine's job. It's not just Karen's job. All of us have to lean in and make plans and move. So we are very committed. This is part of that commitment, hearing from communities. We did want to start by hearing from healthcare workers, and you know, when there's difficult situations in communities, we feel it's important to go into those communities and talk about the challenges in healthcare so that we can find solutions together. So, you know, there's no perfect science to it, but we are committed to hearing directly from people who are affected and looking at solutions moving forward.
Yeah, in the department, we do have an equity and engagement division, so we have a specific group of people that it is their job to focus on public engagement, and they work very closely with their colleagues at Nova Scotia Health and the IWK Health Centre also in Halifax. And what they're doing right now is work over the next year as we work toward a health equity framework. The framework is required by legislation. And so what they're doing is they're going to be doing a series of public engagements as well, similar to this, but also surveys and gathering information from communities, going to various communities to map what assets you currently have in your community to determine where else we may need to augment there. So I think that's the group's been in the department only since the spring of 2021 is when we set it up. So really just kind of hitting the ground running now, but very, very committed to community engagement and hearing from folks like you as we roll out various initiatives throughout the department. And so both, I think the minister said there's health system engagement and then there's community engagement. And we do have folks specifically doing that right now.
Thanks. I'm just going to add one, I guess, component. Our health leadership group meets every week. We meet on Wednesdays. Typically, it's the bulk of Wednesday afternoon, and often we'll invite groups in. So, for example, you know, you mentioned EHS. Well, we shortly have a meeting with the president of Medivy, which is the owner, operator of EHS and Blue Cross and so forth. That's an example. Doctors Nova Scotia would come in, the colleges, exactly, so Royal physicians and surgeons, nurses, the universities. So, you know, the question was about engaging the stakeholders, and I would simply, to sort of round it out, say that we do have an opportunity to invite and to hear, and we do. Anybody who wants to speak to us pretty much has an invitation to do that. So we've been listening, that's for sure, and hopefully tonight we'll have a chance to talk about some action too. So,
Thank you. Yeah, and I wonder if we can turn the mics up just a little bit. I think it's hard to hear, if that's okay. Thank you. Thank you. Looking to you in the audience now, and just to let you know, you don't have to stand up. We have a mic. We have mic runners that will take the mic to you. So we have someone right up here. Yep. So this is, I say I feel like an auctioneer, just so you know, because I do like the little point, like 1, 2, 3. And I always know that's that, you know, is it rude to point? But yeah, you go ahead.
Hi. My name is Charlie Morrison. I'm a paramedic here in the area. And I have a bit of a preamble before I ask the question. But I see and hear these days that we are going out of country for recruiting paramedics. Apparently England and Dubai are two places we're considering. We have medics here, and they're working their butts off, and they're trying to keep the dam from overflowing, the healthcare dam from overflowing. Our responsibilities are ever-changing, new roles at the hospital without being NSHA employees. We are doing nursing, RT, and tech-like duties at the hospital, and the patient numbers are at an all-time high. Paramedics are caring in the hallways for sick patients that should be in rooms, but we just don't have the ER staff to take care of them. And we have nowhere to send the patients that are in the ER. Apparently, lots of times they can't get to the ICU and such. Our paramedic liabilities are increasing, our stress levels are increasing, and we have been offered no extra compensation for any of this. From my point of view, on the front lines, it appears nothing is being done to stem the tide of medics leaving the industry. The items listed above are only a small part of why people are exiting. No one appears to care, and I hope I'm wrong about that. We have medics looking to work casual after leaving a term or a full-time position, and they're being refused that honor. 20-year-plus veterans are having to be rehired as a casual instead of just transitioning. Now, instead of getting shifts from these folks, we get nothing, and the rest of us suffer. This is a story being repeated all over the province. I have to ask for my own sanity and peace of mind, what specifically is being done to keep those that are here withering on the front lines while we recruit? Seriously, what's the plan? Recruiting does not solve anything if you can't keep who you have. So think about that for a second. And now think about it again. Please, with all respect, how do you keep us afloat if the people you have keep leaving? I need some kind of hope to cling to that those that you have are just as important as those you are looking for. Do something to prove this, and because I don't know how much longer we can take it, I just don't know. The people that keep this service running, and that would be the paramedics, are constantly treated like we don't matter. You need to change this. Get off your butts and do something to inspire us instead of depressing and taking us for granted. So a little bit of a story here to drive home the taking us for granted. So just after the storm we had in September, myself and another medic took a shift up in Neils Harbor. And for those that don't know, that's a 24-hour shift for us. At that time, it was tough to get gas anywhere. And so we went to management and we asked the question, can we get one of our trucks topped off? We're going to travel together. We just want to make sure we're going to get home. And neither one of us had enough gas to get up and back. But we wanted to make sure that the community had somebody there. And we were told no. They wouldn't top us up. So the next morning, we set out and went to 3 gas stations before we finally waited for 40 minutes to get our gas. And we then headed towards Neils Harbor, where we were 20 minutes late. Now the irony is that if we had been replacing somebody and we weren't, their overtime probably would have been much more than the $25 that we needed to top off our gas. So we were told that they didn't want to set a precedent for this. Helping out after a hurricane, I guess, is a precedent, which is ridiculous. We even offered to pay from our wages for the fuel, and still no joy. So how do we not feel deflated after such a ridiculous decision? It was $25. It's pitiful. So my question becomes, what are we doing to keep the medics that we have? I hear nothing but recruitment. I don't hear anything about retention. And I would like to know what the plan is.
So thank you for that. It is? Okay. So thank you. I do want you to know that you're important, and I do want you to know that you matter, and we know that the paramedics are under an awful lot of stress. There is a gentleman here this evening. I'm just trying to find Jeff. Yeah, there you are, Jeff. What I'd like to do is have Jeff Fraser come up and speak with you. I don't know if you're familiar with Jeff. You do, yeah. And Jeff can talk a little bit about what's happening exactly around some of the work with paramedics. You're right, we need to recruit and we need to retain. So Jeff, I'll let you take the floor and then we'll go from there, okay?
Okay. Good questions, good points. So as Charlie would know, I worked at the ground ambulance provider for a number of years and retired as a paramedic about 2 years ago. I went to 2-in-1 Nova Scotia, and when government changed, there was an opportunity for me to come back as a regulator of the system. So I've changed roles as an operator to a regulator. I started in April, and the paramedic workforce meetings were well underway. So government, and I think the minister alluded to this earlier, we began to build a partnership. So she talked about Kevin, who's a local guy, who does hold me to account on a regular basis around these things. Every month we meet. We have folks from the Health Authority, IWK, Office of Professional Healthcare Recruitment, the employer, the union, and amongst others. And so, Charlie, you are right. And even though EMC is the operator which is responsible to recruit the people, we are, with this new office being formed, we're really getting involved in that. So as a regulator, really our role is noses are in, fingers are out. And so we provide guidance to the operator, and that's what we're doing right now. When it comes to retention, our last couple meetings, we really started to dig into this a little bit, and I changed the agenda format just to dig into it. So Kevin had an opportunity to share with the group some of the similar things that you had talked about, not necessarily exactly the same, but themes of things that are really grinding people's gears. So what we are going to do as a regulator, because it's very, very important to understand, what the temperature is and what the issues are, is that we will be in early spring, late winter 2023. We are going to be doing paramedic town halls across the province and really going to focus on culture as a regulator. Regulators never really done that before, but it's really important for us to understand what's happening out there. There are things that we are working on to address things like retention, and I agree with you. Like recruiting is only a part of it. It's recruiting and retention. And when I was in Kempville the other night, I had a paramedic ask a question around what are you going to do? Where show me the money type discussion. But you read before you got to your point, you read a lot of challenges that are happening in the system, and so we have to address some of those challenges too. So bringing in new people and not acknowledging the people that are in the service without fixing some of these chronic problems that do affect you and all of your peers. Those are the things that are at the form of what we're looking at right now. So we've got a few things in the hopper. Trust me, you're well represented every month when Kevin comes to the meeting. He brings the issues, he makes it real, and it's my and my team's job to make sure that we react in an appropriate manner to those things. I cannot give you justice, but I can give you change. And so what we're going to do is we're going to focus on making the changes within our service over the next number of years. And this is big. It's like turning an aircraft carrier with a paddle. It's not going to happen overnight, but we are building a plan and we're starting to execute on that plan. And so all as I can tell you is I'm sorry for your experience that happened in Cape Breton. I'd like to talk to you afterwards about it just a little bit to understand a bit more. But the status quo for us is not an option.
Okay, thank you. Now, there's some other hands that were up when we started. So I think, did you have your hand up as well? And then, so I'm trying to make sure we're fair. So if I don't, yeah. So we'll do one, and then two. Yep.
Hello. I appreciate what this fellow had to say, although my question wasn't quite kind of coincides a little bit, so I don't know if it can be covered in my question, but as we approach the Christmas season, we are now at the anniversary of when the JABA mandates were implemented. Unfortunately, hundreds of healthcare workers in Nova Scotia are still not able to return to work, while many others are now gainfully employed in New Brunswick and beyond. Whilst these mandates have since been rescinded for the most part, there are still well over 250, I'm sure that number's higher, Nova Scotian healthcare workers who have been sidelined, unpaid, and seemingly forgotten. This is unjust and lacks humanity for them and the patients who need them. All because what is called a high-risk jabination mandate that has been dropped in most of the rest of Canada and the world months ago. We desperately need these doctors, nurses, paramedics, long care workers back with the patients. To not enable them to return immediately is impractical, unjustified, and is contributing to medical negligence in Nova Scotia citizens. Why not the province or Tim Houston hire back these healthcare workers and nurses and doctors who were fired because of JABA mandates that have long been lifted? Other provinces have done so, like our sister province, New Brunswick. So why is our province so eager to hire outside the province, or country for that matter, instead of rehiring those who are already trained, qualified, and know the people and patients in their local areas? And before you answer this question, please consider this. In April of 2022, Dr. Strang and Premier Tim Houston had expressed that we need to embrace living with COVID-19, get back out there, and allow healthcare choices to be personal choices based on individual responsibility once again. Even Dr. Lisa Barrett, who did not align with Dr. Strain on lifting restrictions at the time, said, "What is true is that the COVID jabs don't prevent all infection and transmission, but they were never meant to do that." I say, stop calling the unjabbed and call them back to work. Please explain to them and us why this province has not hired them back. Thank you. And that bodes well with this gentleman and the paramedics, because there's already been reports in a 24-hour period, 800 calls, and in one area in the Annapolis Valley, still after 23 hours, they didn't get any ambulance there. People are dying before ambulances are showing up. So why aren't you hiring back the ones you fired when all these mandates have been lifted already? Thank you very much.
Thank you. I appreciate your point of view. We've heard this certainly at other town halls around the province. There is a policy in place at the moment. There's no intent to deviate from that policy. The time may come. At the moment, however, at Nova Scotia Health, in fact, there are, as of Monday, I didn't look today, but as of Monday, there were 127 healthcare workers who are off work as a result of not being vaccinated. And there are 7 at the IWK. That's of 26,000 plus employees. So I hear your point, I take your point. At the moment, there's no intent to change our policy. And I can't argue. I can't argue with you. It just is what it is at this stage in the game. So I know there's lots of questions. I'm sure if we have an opportunity to come back, we could. But first, we're going to go around and make sure that everybody has a chance to ask their question. So thank you.
Well, the follow-up, you just reported how many non-jabbed are off sick. How come you're not reporting all those who are jabbed that are off sick? You're not reporting any of those. Because I know a lot of healthcare workers who had their jab who are off on sick leave right now because they got the COVID.
It's a different issue. So thank you.
I think that was a misunderstanding. The statistics were the people that were off that were not vaccinated,
Correct.
not the people that were off sick because they weren't vaccinated. No. That wasn't I think that was just a misunderstanding in the language. So we will go to, you have a question as well? Thank you.
My question concerns the number of ongoing complaints that are presently registered regarding quality of care, poor or fatal outcomes following visits to the Cape Breton Regional Hospital ER department. My daughter being one of these cases. My daughter died in February following a visit to the Cape Breton Regional Hospital ER department. We sent her there by ambulance. She had an extensive cardiac history, was exhibiting symptoms of having difficulty breathing, very low oxygen saturation, falling levels of consciousness. She was in the ER department less than 2 hours. The physician that attended to her did not give any attention to her cardiac history whatsoever. She died at home 36 hours later with 4 paramedics trying to revive her. Her artificial pulmonary valve tore. We don't know when, but my suspicion is that it happened prior to our sending her to the ER that night. My experience with the complaint process with Nova Scotia Health Authority has been a very frustrating, belittling, exhausting process. And I still am not satisfied after over 6 months since we lodged our complaint. I received a letter dated by Dr. Angus Gardner that was dated June the 6th. It took over 3 months to arrive in my mailbox, and that was only after I made numerous phone calls, emails to the complaint department, the people that handle these things. In my opinion, the complaint process is a sham. And I'm just wondering how many people in this room right now are people who have an ongoing complaint. In this small number of people, how many have a complaint?
I don't know the issues surrounding this particular complaint, and even if I did, we could not speak to specifics of an individual situation. I've made a note. When I go back to work, I'm going to check into it. I'm not sure that Brett or Dawn could add anything more to it. I don't know why it takes so long to get a letter. I don't know why it takes so long for a letter dated June 6th to take 3 months. I mean, look, I'm a mother too. I would be incensed, 100%, 100%. So I can't answer. I will find out, and I will get you an answer. So I appreciate it, and I can tell you, of course, any complaint process, they take too long. It's never fast enough, and it's never enough. It's never enough. So I will do the best I can, ma'am. I honestly, as I say, I'm a mother too, and I really can't even imagine what you have gone through. So leave it with me. I will get you an answer. That's a promise.
Thank you. Oh, another question over here. And did you have a question here? Okay, so we'll go here and then we'll go to you.
Hello, my name is George Whalen. I didn't know this was all about healthcare workers here tonight. I just knew it was about the health of Cape Breton. Now, myself and my friend, we came here with environmental health concerns. We have a toxic pond or lake in the center of town here that's full of E. coli and other very dangerous bacteria. We've been fighting with the provincial government, the municipal government, to get us tested. We were told we weren't allowed to test it. We did though. That's how we found out what's in that water up there, and little kids up there fishing. And if they touched their face or anything else, they could die. Now, what will the province do to clean this mess up that's in the middle of our town? We're not even allowed to put a sign there to warn people because our local mayor has the street department tear them down. And it's a put and take lake that the province supplies the fish to. How many of these kids, a week later after eating fish and playing in the water up there, have become ill, and it was just passed off as a bad case of the flu? We didn't know because we didn't know what was in there, but the municipality did.
Hey, George. Excuse me, mic. Oh, there is working. There must be a delay for some reason because the mic never works when you first pick it up. So, George, as you know, you and Donnie know both very well. You've been to my office many times. We've discussed this topic over and over again, and we have made some gains. I think you would have had your answers had the Queen's service not been on May 19th, because at that time we were able to secure a meeting with the CBRN mayor and with the councillor for the district and some of the engineers that were involved with that could be involved with what happened up there at the dam. So the E. coli is a result of the geese that are there, which blew my mind when I first seen it. It was absolutely, it's terrible. It really is. I agree with everything George is saying. I really do. But to say the province not working on it is not true. That's not true. Because we've been able to get movement because we went to the province and came back downhill. That's what we did. And that's how we were able to secure this meeting, which, as we know, you know, we're planning on now in January. Let them get through the Christmas and that meeting will happen. I don't know if it's fair to discuss here because what Joanne just shared with us has nothing to do with the dam. And Joanne, I'm going to say to you here now, I have a story very similar, very similar. And I wasn't aware of your story. I didn't know that, honest to God. But I'll tell you, I'll stand shoulder to shoulder with you to get your answers. And I mean that. And I know this department here with me, I know that, I get that. But I'll stand beside you to get the answer because you deserve it. But I also want to say this. Since I got the mic, I want to say this. To say that we're doing nothing for paramedics right now, I don't think it's totally fair. I'm surprised you didn't announce it because the powerlift trucks and the powerlift stretchers were a direct intent. Now it's not financial conservation, I get that. But one of the things that are keeping paramedics off is injuries. And that was, off the top of my head, $3.1 million? Something like that? So, I mean, that's important. That is important. I truly believe there are some big issues inside paramedicine. I think in your company, I have many people come to my office, paramedics, that are sharing a lot of stories that I think are the working relationship inside the company. I think there's some big issues there. I do. That's just what I'm hearing. If it's true or false, I don't know, but it's what I'm hearing from people who are sitting in front of me crying their eyes out. And I think we need to, look, before we started here tonight, I was talking to Nancy about what Glace Bay is. And Glace Bay is a proud coal mining, hard-working community. There's no doubt about that. We all know where we came from. We all know here. But what we also know is that we've been through hell and back again. And I think right now this ship has turned around. I truly believe that. And I think that what we need to do is start looking at, okay, there's been some wrong done. There's been some great wrong done. But let's fix it and move forward. Let's get the answers and move forward. I don't want to look rear view mirror anymore. I want to move forward. I want to get these things fixed and move forward. I think we need that dam clean because I fished there my whole life. We absolutely need that clean. That's all I did as a kid. Paddle down from Aberdeen and go fishing. That's all we did. And I think that kids today should be able to do that as well as the seniors and to be able to use the platform that's there. I think you guys deserve to go to work as paramedics and be taken care of and know that you have somebody looking after you. I truly believe that. The PSP net is another part that's there, but I know you guys have a critical incident stress system designed. Chris Campbell, for example, works on the provincial system team with me. I know he's a well-trained individual. I know he's there to help you with the critical incident stress that you guys deal with on a daily basis. As a firefighter myself and MFR, I see you guys as angels when you walk in the door. Every firefighter see you walk in the door behind us. We see you as the face of an angel to help us. We know that. And I have the utmost respect for every single one of you. And if there's something I can do to help you, I'm going to do it. If that's compensation, that's beyond my hands. It's not my department. But if it's to help you get through a day, if it's to help address some issues you're having at work, such as back injuries, which was the #1 complaint, then powerlift truck and powerlift stretchers makes a difference. So I think we're doing what we can to keep paramedics on the truck. And I also think that, Joanne, you deserve that answer, and it's long overdue. It is long overdue. I agree with you 100%. And there's probably many more. I know there are. But George, I took the mic for you. So I'll take the mic for you because I really want to let you know that you know you have my support. You know that 100%. You do know that, right? And I promise you that the people that are going to help us get these answers are working with us. I've already promised. You've seen that in writing. You know that already. It's not really fair to discuss it here now because the municipality is not represented, and we shouldn't be condemning somebody. But no, this is about healthcare. This is about healthcare. Yeah, but we're not talking about physical health. We're not talking about skating. We're not talking about swimming. We're not. So it's a different story. I think it's a totally different story today, guys. I really think that people came here today to hear about this side of things, and we would be only stealing their time. So I don't want to do that. But if we need a town hall, we'll have a town hall. I'm not worried about that. We'll get our answers. All right? Thank you, guys.
Actually, we have somebody over here that had a question. Yeah, so we'll get here, and then, oh gosh, okay, 1, 2, 3, 4, 5. And the last time I did this, I forgot numbers, so just keep me honest.
You're going to hold it? Okay. Hi, my name is Angela Ferris. I'm an advanced care paramedic employed with Nova Scotia Health Authority. I've also worked with Alberta Health EMS for the last 15 years and was there for the height of the pandemic. This is not my comfort zone, being up here asking questions, so please bear with me. My comfort zone is in an ambulance. I'm going to just kind of reiterate what Darlene here had mentioned, as it is a huge concern for me. I know that you probably don't have the answer, and the answer will be similar to what you had already said, and I would just appreciate the floor, even if you can't answer the question. Pfizer executives have stated that the COVID-19 vaccine was never tested to determine if it prevented transmission of coronavirus. When healthcare workers have asked public health for evidence showing that the mandate or the vaccine prevents transmission, they were given a standard answer: to get vaccinated to protect others and to vaccinate to prevent severe disease, so that they did not become ill and did not burden the healthcare system. Healthcare workers have not been given any data or evidence to suggest that the unvaccinated healthcare workers put others at risk. They are intelligent people, as the four of you know. They know how to analyze and read data and numbers. From the Government of Nova Scotia's own website, 57% of deaths from Omicron have had 3 doses of the vaccine. 25% of those deaths have had 2 doses of the vaccine. And 17% of people who died from Omicron have had 1 or none. We all know that being vaccinated does not prevent the spread of coronavirus. By the percentages that I just listed, it does not protect from death for most individuals, and a lot of our healthcare workers do not fall within that high-risk category. They're very healthy, young professionals who are working in our healthcare industry, and the median age of death is 83 years old. We have members of the public who are dying in overcrowded ERs from a lack of staff, dying at home because of a lack of ambulances. Nurses are driving from Nova Scotia to New Brunswick because of vaccine mandates. They have been dropped just 6 hours away from here. Healthcare workers are leaving Nova Scotia because Alberta has dropped the vaccine mandate back in March of 2022. I do not see massive deaths from COVID happening in these provinces due to the unvaccinated spreading the disease. 4,000 unvaccinated healthcare workers in Alberta right now. Vaccine efficacy wanes after 9 months. So all the vaccinated healthcare workers are at a similar risk to the unvaccinated, in my opinion. Healthcare workers have emailed MLAs and MPs who state it's public health enforcing the mandate. When public health is asked, they state that it's the employer. When the employer asks, they state that it's public health. Government, public health, Nova Scotia Health Authority, you are all one and the same, in my opinion. You're passing the buck with no real answers. Science must be different in Alberta and New Brunswick, but I believe it's political science. You have overworked, burnt out nurses, doctors, paramedics, and support staff that need more help. Let healthcare workers back to work to do their jobs, which is to help all Nova Scotians, no matter what they choose. This is causing more harm than good. Can you please give
Okay, girl, you got this. You got this. Can you please give healthcare workers who are selfless and hardworking a reason? You're not giving us reason. We just want the data or the information or the proof or the evidence that states the vaccine prevents spread. And we're not getting that. We're just asking for the proof of that or the evidence or the information that you have that shows that that's saving people. That's all that we're asking. There are more,
there are more healthcare workers than I think that are being reported to you. I know of 300 and other workers in the province. We've heard there's 800 to 1,000. Thank you for listening. I appreciate it.
Thank you for your comments. Thank you.
Thank you. Wait, another, no, you don't need a question?
No, we answered it. We answered it. The policy is, yeah.
No, and I appreciate it, and I think that, and I thank you for sharing your story and giving the opportunity to be heard. There was another question. The purple? Yep. Yep.
Thank you very much. My name is Mel Bryden. I'm the president of the Reserve Mine Seniors and Pensioners. I'm also a local businessman here in Glace Bay for 37 years. And unfortunately, we're not going to be able to survive because of COVID, which is sad. But at the beginning of COVID, I started a program in our community that was to provide a meals program to our seniors. And as we all know, a happy senior is like having a happy wife, a good life, right? And the thing of it is that we've had a great relationship with the previous government. And up to the point of 18 months, we served 52,000 meals in the Glace Bay and Reserve Mines area. And as John knows, our name is out there everywhere. We've been on the TV, we've been everything. And we put our application in when the Tim Houston government took over, and it was like we never heard another word because we wanted to continue the program. So back in March, we did it again and still never heard anything. But come this fall, in September, after Fiona, Communities, Culture and Heritage contacted me and said, "Are you still interested in doing the program?" So it took a disaster for us to get money from the provincial government to continue the program that we were doing. And yes, we were lucky enough to receive $90,000 and provide this again through this winter, which we're doing. We're feeding 500 people a week. But just during Fiona alone, I have near 200 members in our organization. And in the last year and a half, we lost 20 of them members that literally died. Besides doing the meals, we had a program where we had people calling people, just touching base. We had a drive-you service to take you to your doctor's appointments, to your medical appointments, and other things. And if you needed groceries, we made sure you got them. And it was so sad for us to have to stop doing that program because of the fact that it didn't get to the people that should have got to. I'm not sure how it works in your department, but we did have a great camaraderie with the Communities, Culture and Heritage. They came to our facility. We even built an outdoor facility last year so we can live post-COVID. During COVID alone, in 9 days, 36 people fed 14,000 people in this town. We fed thank you. We fed every seniors complex in Glace Bay and Reserve Mines. We fed the people in Steeles Hill, number 2, and Caledonia, going to their door, making sure they had a hot meal. And we were very fortunate because we were able to do that because of the fact that we had a system where the power went out and we have a Generac, thanks to the government of Canada. Okay? We also fed the warming centers. Nobody gave one of our warming centers $5 to provide a lunch to anybody that was there for the day. So we did that. We did that on our dime, and don't get me wrong, people were amazing afterwards and helped us full time. But being a nonprofit organization and the province giving money to organizations like the United Way, if you don't have a charity license, you don't get money. And being a nonprofit, I just feel that the reason I'm talking about this tonight is because I think it's important that our Minister of Health in particular, like those people, 20 people died, 4 at one given time, because we knocked on doors, because we delivered meals, we had 4 people that actually stroked, that we were able to get to the hospital, and they're still alive today. But we also had 20 people that passed away. And I believe in my heart, it wasn't because of COVID, it was because mentally, physically, and emotionally they were drained, they had no social life, and people will tell you about our organization. We constantly bring our people together. And guess what that does for you? It keeps us out of the hospitals. Okay? And if we're out of the hospitals, we're not a burden. So the reason I'm bringing this up, Mrs. Minister, Ms. Thompson, is that I'm hoping that we can continue what we're doing for as long as it is necessary. And right now, we did a program every year. Every year we do a program at Christmas time, and the program is to support seniors and low-income families, and we ask them what they need for Christmas. And it was always a pair of boots, a jacket, whatever. You know what they're asking me for today? Oil and food. I hope I don't need an answer for this. I just want you to think about this, and maybe we can work better together. Thank you.
So thank you very much for that, and thank you for everything you do to feed that number of people with that small army of individuals is pretty amazing. So I know. Well, I got a job for you. What do you want to work in healthcare? I got a job for you. No. Yeah. I know. We got lots of work to do. Yeah. So we have a ministry now of seniors and long-term care. I don't know if you realize that. So Barbara Adams is the Minister of Seniors and Long-Term Care and looking at different ways to support seniors living in community. So I don't know if she's aware of your organization, and I'm not sure where you typically get your funding. So that's something that I'll check in with you after and with Johnny about, so that we can understand where the change happened. If it's community's culture. Oh, right on. That's okay. Who's your MLA? Yeah. Who is it? Oh, okay. Yeah, okay. No, I don't. Yeah, no. That doesn't matter. Yeah. No, that shouldn't matter. Because yeah, what's important is the seniors get support, but I think it's important that we look at the streams through seniors and long-term care, and we understand how to support the organization. And to your point, we recently had an opportunity to talk to Denmark about what they do for senior support, because we had a chance to talk about their seniors care. And one of the things they do there is that at age 65, whether you need it or want it or not, you're assessed in your home by a physio or a physio assistant, and you have a number of different things to look at how you're functioning and what your goals are for the next year. And one of the things they do is a loneliness assessment. It is. It's amazing. So we recently had the opportunity to see that. And so I think there's an opportunity for us to understand the work that you do and connect you to the right folks. So thank you.
Well, actually, the loneliness point is not to be underestimated. And we also know that there is a percentage of persons who call 911 because of loneliness. To talk, they're scared. Believe me, there could be many, many reasons, but it is not because of a emergency in the true sense of, what we would talk about. So it is a real issue, and we don't even know how big of an issue it's going to be post-COVID. We don't know yet. That's the fact of it. So thank you for raising it. I've made a note. So the 90K came through culture and heritage, and is that where it has come historically? Okay. Okay, thank you.
Thank you. There's a question up here.
My name is Michelle McLean. Thank you. My name is Michelle McLean. I live out in Millville. And I just want to preface too, like this gentleman over here did, the EHS gentleman, with some information. I saw in a news briefing by Minister of Health Duclos, Mr. Duclos, back in June 22nd, saying that after 9 months of getting the, and I know you're probably tired of hearing about this vaccine stuff, but there's a point and there's a question. After the second dose of the primary series, the vaccine efficacy wanes, almost to the point where there's no vaccine left to fight COVID. It's not mandatory that healthcare workers get boosters. So when you look at folks who do not get boosters after their second shot of the primary series, they're almost on the same playing field as folks who are unvaccinated. I chose not to, I'm not in the healthcare setting, but I'm in what's considered, I was in what was considered a high-risk setting. So after 32 years of working with child welfare and the Department of Community Services with the Disability Support Program, I was put on unpaid leave, like I say, after a career of 32 years. And during that time of being put on unpaid leave, I had lots of opportunity to do my own research, scientific research, and I found out so much information about the vaccine. I have two health reasons as to why I would not get vaccinated. One is because I have what's called Raynaud syndrome. It's an autoimmune condition. And the other is I have a maternal history, long line of history on my mother's side of congestive heart failure. So when I researched the information on the COVID vaccine, Pfizer was court-ordered to release a document maybe about a year ago in the US. In that document, and anyone can research it, they can look it up on the internet, it's called Pfizer Data Release 5.3.6. In this document, there are 32 pages, paragraph form, not listed in point form, in paragraph form of adverse reactions that people are reporting. Two of those include thrombosis, which are blood clots, and another is myocarditis, which is inflammation of the heart, which causes heart issues, cardiac arrest, stroke. So at my age of 58, when I was diagnosed with Raynaud syndrome when I was 19, at the age of 59, I'm going to assume that that condition hasn't gotten any better. It's either stayed the same or it's gotten worse. So because of those health issues, I made the choice, because of fear of an adverse reaction, to not get vaccinated. So I also found out, and it's been knowledge, common knowledge for about a year, that the COVID vaccine does not prevent transmission. It does not prevent anyone from getting COVID. It does not prevent people from being hospitalized, and people are obviously dying of COVID. So it doesn't prevent death from COVID either. So my concern is, and in talking with a reporter from the Chronicle Herald recently, he indicated that in his research, there are 800 to 1,000 healthcare workers in Nova Scotia who were put on unpaid leave because of their own reasons would not get vaccinated. So it's so frustrating for me to see all these people who are not getting care, some folks who are even dying, sadly. And we still don't get answers as to why, with all of the information now that's out there, everyone, I'm sure, in healthcare is aware of the information, and if not, they should be. Because if I, as a layperson, can investigate this and find out about this scientific information that comes from places like The Lancet, the American Journal of Medicine, the Brownstone Institute, they are all highly reputable journals of medicine that provide scientific information. So again, and I've sent many emails with my story, with the information I've found out about to politicians, to MLAs, to senators, to your office, Ms. Thompson, to Tim Houston, to Dr. Strang. And I've got no response from anybody. And it's just like here this evening, nobody seems to want to touch this. But it's so frustrating to know that there are 800 to 1,000 healthcare workers who are good workers, who have had long histories. I've had 32 years of a career, but because I was fearful of an adverse reaction, I was put on unpaid leave and can no longer do the job that I did, that I loved, that I was very good at. And there are so many of us who are suffering, not only because of what's happened to us with our professions, but we also realize that as good workers for Nova Scotians, they're missing out on us being able to provide them with the care that they should have. And nobody is taking responsibility for it. Nobody wants to answer questions about it. Nobody wants to touch. It's almost like it's a faux pas. You know, don't go near it, don't answer it. No, we don't have an answer, they don't have an answer, just brush it under the rug. And I'll finish up with one of the biggest things that impacted me recently, because some people will say, oh, you know, the vaccine is no different than the flu vaccine. It is. It's an experimental vaccine, it's an mRNA vaccine, and I didn't realize until recently that as of December 8th, 2020, the Government of Canada has developed a vaccine injury compensation support fund for people who are seriously harmed from these vaccines. And when you look at the adverse reactions, 32 pages of adverse reactions for the COVID vaccine, I looked up how many adverse reactions there are from the flu vaccine, 6 to a dozen, compared to 32 pages long, paragraph form. So people should have the choice, and my concern is that no one, whether it's the government of Nova Scotia, whether it's the health authority, no one is taking the bull by the horn other than every other province except Nova Scotia and BC. That's my understanding. Somebody can correct me if I'm wrong. We are the only two provinces, Nova Scotia and British Columbia, who still have vaccine mandates with all of this information that's out there. And nobody is dealing with it. Nobody is taking it on. And I don't understand why.
I guess, was there a question particularly, or just?
Well, and I think it's not been answered anyway, so and I guess my question is, why is it that somebody is not taking the bull by the horn and saying, we need to get these people back? Because there's not enough, there's no evidence to say that we should. I'll give you an example.
You know what? I don't think we're going to get to the bottom of it tonight, and there's a lot of people in the room, and I appreciate your viewpoint, and you're here together, and I appreciate that you have concerns.
Can I add just one more
you
quick
You
thing?
can, but we're not going to have an answer for you tonight.
Oh, no, that's okay. That's
Yeah.
okay.
Okay.
I can go in the hospital. I have a sister-in-law whose mom is 92. She needs someone to go in and sit with her in the hospital because she's a flight risk. She's not doing well. I can go in and sit with this woman every day, hour upon hour upon hour, which I'm going to do because I have the time, because I have no job. I can go in and sit with this woman, which I will do as a layperson, but I can't go in a hospital as a disability support worker and do my job that I've done for so many years. It doesn't make sense. But thank you. Thank you for the time.
Thank you. Okay, we have another question back here. Oh. Yep.
Gee, I'm take this off. Oh, okay. You hold it. All right, good enough. My name's Wendy, and I'm a retired healthcare worker. I worked for 38 years as a physiotherapist full-time throughout Cape Breton and on the mainland down through the Antigonish, Guysborough, Canso area, St. Mary's, and spent years as a therapist working with the patients, patient care at the old St. Rita's Hospital when I first started in 1976. I'm 66 now, and I've been retired for 6 years. But I wanted to share a little bit about what I witnessed as I worked over the last 38 years. And one thing was, certainly as a therapist, I became more busy. When we started at St. Rita's initially in 1976, there was one therapist at a regional hospital, significant size, and one therapist that worked outpatients. At that time, we had, because outpatients was somewhat busy, people coming in from home after they were discharged, we had an assistant there. So that was helpful. I remember having an argument with my boss at the time to say that I wanted to have an assistant to work with me on inpatients on the floors. And thank God for nursing and nursing assistants, because they would often help me and I would help them, because I often took the patient to the bathroom after I took them for a walk, and the nurse, and then helped get them back to bed. But over the years, I had an opportunity to work at a rehab center at Harborview. And Harborview Hospital, anyone that's gone there, have done very well in terms of feedback with regards to the type of care that we provided in there. And one of the reasons that we provided excellent care, I believe, is that we provided a team approach to care. And patients would come from an acute care setting to a rehab setting or a transitional setting before they were transferred home. And they would be followed by speech therapists, physiotherapists, occupational therapists, dietitians, social workers, allied health people, allied health representatives. Subsequent to that, I had an opportunity to take a new job. Myself and another occupational therapist were asked to look at a new project. And the project was related to patient flow. At the time, we recognized that there was a backup of patients that could not be admitted home because they were elderly patients who had recovered from their acute condition, but they required supports at home. Now, the issue there, or they were waiting for a transfer to long-term care. The other issue we saw when we looked at the flow of the patient from admission to the ER, perhaps, and then admission into the hospital, was there were some patients that could have went home from the emergency department if they had follow-up allied health supports, social worker support, occupational therapist support, or physiotherapy support. Now, we did grow to a point where we were given support for hiring more allied health, that's rehab services staff, and social worker to follow up people once they are discharged from hospital to their home. And we created a team which we called the Rapid Assessment Team, or the RAT team, and we were kind of known a little better in our local area. But I was, myself and another therapist, occupational therapist, Ainsley McNeil, were the first ones who followed through with this. But it was our pleasure to work with the emergency department nurses and the emergency physicians and the social worker that we were able to pull in and give us a little extra time. So we managed to get a little bit more time from them. So over my career, we saw that our profession expanded. We worked together with other professions, so we became less siloed. We worked together as a team, we were stronger. We had an opportunity to request more support on the inpatient. So now the Physiotherapists College of Physiotherapy in Nova Scotia, we created a program whereby we trained assistants, physiotherapy assistants, to help with therapists work with those patients that were admitted in the hospital to facilitate a return or discharge home. And we have an opportunity also over the years to be involved with discharge planning with nursing department and their discharge planners and other allied health. So I just posed that question at the beginning of the night, was my question that I sent in, was what other stakeholders are at the table when you're discussing how we're going to change the way we're doing business at this point in time? And also, do we still have this in place? Do you have a clinical engineer on board that you can look at patient flow from at home to entry into an urgent or emergent setting, and then admission or not, admission, if admission, then who's on board with that patient when they're in the hospital? And how's the communication? Is it siloed, or are you working as a team through acute care? Those are just some ideas. Eventually I retired, and I just wonder whether that still existed. And probably the change that I noticed the most was when we did move to one health authority. It's difficult to communicate when you have one health authority. You would hope that you had a lead in each district. But I just wanted to pass that on, and I'm suggesting to anyone, if you do work, when you retire, try not to get involved in too much, but it's nice to...
We're just about ready to ask you to come back to work.
We
We have a
we
job.
already decided you're rehired.
So we'll start by talking a little bit about the team approach. So there's a couple of things. There is a home first approach, a home first initiative that I think the folks in continuing care can probably mention a little bit. We're also Michelle's there. She can give us an update on that. But also in primary care, we're seeing that our newer physicians, our more senior, more experienced physicians worked on their own. A lot of us had the same physician. You go in and visit them, they did a little bit of everything, but the more novice, the newer physicians want to work in a team-based approach. So the team is really an essential part in terms of how we also maximize scopes of practice. So to your point, how do we make sure that people are working to the best and highest use, and that we're not doing tasks that we're not responsible for or don't need to be responsible for? And also, when there are entry-level positions, how do we make it really easy to ladder? So if you come into the system as a continuing care assistant, if you want to, how can we help you ladder to LPN if that's what you choose, or to RN? Similar primary care paramedics. How do we bridge them to ACPs, advanced care paramedics, and then critical care paramedics? So we want to make a clear pathway, if that's a pathway that folks, make it easier for folks. So there's a number of things that are happening, but Michelle, do you want to talk about the Home First initiative?
Yeah, well, the good news is RAT is still in place. I was actually in a meeting a few days ago about looking about how we can expand RAT within the zone and looking at other hospitals within our zone. And I know there's some provincial interest. So 6 years later, your legacy is still there. So that's good news. And just, I think, to follow up from what Minister Thompson was saying, team-based care, we know the importance of it. I'm a social worker by trade, so also come from the allied health world and know the importance of how we support patients more globally. And as Minister Thompson said, there's lots of work from a home first perspective, recognizing that when patients, how do we support them when they come into hospital, but more importantly, how do we support them to go home and then keep people at home? We want to make sure that we can keep the four walls of our hospital for those who are really sick and need our care the most, and really expanding some of our programs out into the community.
Thank you. And I think we had a question here and then one back here. So we'll go one and then.
Okay. First, I'm going to take the feed off of what Mel said before. My name is David McKeegan, by the way. When he was talking about the seniors who passed away during COVID, there's a lot of grieving took place, and a lot of people had to grieve on their own because families could not gather to get together with the supports. Why isn't the health authority supporting bereavement Cape Breton? Great question. Can you answer it?
Yeah, no, I don't.
I'm sorry Minister Comer's not here, because that's his
Yeah,
department, right?
no, I'm sorry too that he's not here. I would have to get back to you about that to give you the specifics, and I can commit to doing that, or having Minister Comer get back to you, but I'm not sure if there's anyone here in the back that knows about bereavement. I'm sorry, I don't know, is the only answer to that, but I can check with Minister Comer.
And so you have another question too?
I have another question, yeah.
Okay, and I guess I just want to follow up that I know so just make sure you write your information on a contact card so that can get back.
Okay, thank you. Because, yeah, there's a lot of people, and even today, COVID, it's still affecting people, right? And there's still people, they're grieving, and they can't come together to do that. So they need that support. And I think Bereavement Cape Breton, and you guys need to financially support them so they can do what needs to be done. My second one, and I got to say, the paramedics and the nurses and the doctors of Glace Bay are second to none, man. You guys are amazing. My wife's an RN, so. But anyway, a couple of weeks ago, I come into an event here at the Bayplex, and there was an accident down the road. A gentleman on a motorcycle in a car, and he was laying on the road unconscious. Who shows up? Volunteer fire department. They're very highly trained, but they shouldn't be the ones that are responding. An EHS gentleman showed up. I guess he was close by. He showed up a few minutes later. A few minutes is a long time when somebody's laying unconscious. And actually, I left before the ambulance even showed up. When are we going to have the Glace Bay Emergency Department opened up? Ambulance drivers spend so much time going back and forth to Sydney. My parents live in Reserve Street. It's like 24 hours a day, sirens and lights going. They spend more time going back and forth to Sydney when they should be in Glace Bay. It's a 20-minute each way. That's if traffic's good. When are we going to open up? The gentleman before, they were talking about the redevelopment, and what is the redevelopment plan? And he seemed kind of unsure of what it is. So is the redevelopment plan in place, or are they still working on it? And when is our hospital, when is our ER going to open up?
He's going to come up and answer your questions for you, yeah.
So, very good question. I think as you are aware, we did open up the emergency department 2 days a week. Well, it's a start. And so as you're aware, the Cape Breton Regional Hospital services the entire island as the main trauma center and regional center for, 137,000 people, plus visitors, vacationers, etc. One of the major challenges, obviously, is the health human resource challenges. That's right across the country, right across the globe, and it's no different here in Cape Breton, Nova Scotia. So between Glace Bay Emergency Department and the Sydney Emergency Department, we have a significant shortage in relation to registered nurses who are trained to provide emergency care. So that's really the largest challenge that we're faced, and that's why we're only able to open up 2 days a week currently. We do have to make sure that we do have regional access for the island, and that services the entire island. Our goal is to try and, slowly, incrementally open it up. And it's not just about registered nurses, it's about access to trained emergency room physicians. The days are gone when you'd have the ability to have a family practice physician work in an emergency department. I know that used to be the case years ago, just very challenging for a family practice physician to carry all those emergency competencies, all the courses and skills to ensure that they're providing the right care. So to answer your question, it's going to be some time. It's going to take a lot of recruitment. We have work ongoing with universities, government, collaboration, and increasing the seats. So I think back in 2020, we increased, in working with the government at that time, 62 seats at CBU. Then once the new government came in, there's another 28 seats for CBU, plus other additional seats across the province. We will start to see those graduates coming out of CBU this spring. I think it's roughly 25, above and beyond the totals that we always receive. So we'll start to see those graduates bundle, and then we'll start to see more of the 90 seats that are provided to CBU and others, St. FX and Dalhousie. So we will start to see those additional registered nurses come forward. I think we also have to look at what other providers, I think to Wendy's point and others, that can work in an emergency room setting. I'm a registered nurse myself, trained in emergency room care. I worked in the Sydney location. I also did some work down in trauma centers in the United States. And there are different models out there. And we've relied over a long period of time on a heavily based registered nurse model of care for our emergency departments. And we have to start to explore how pharmacists can help. We've already done that in Sydney. Where's the place for a licensed practical nurse in a regional center, in the Glace Bay emergency department? So there is a lot of work for us to do, and we are working on it. We are working forward. And so, you know, it's going to take some time. I can't promise you today that it's going to be back to the way it once was in Glace Bay, but our goal is to get the services back up, to stabilize Sydney, and that way we can use Glace Bay as a viable option to provide care, not just for Glace Bay, but for the entire CBRM. It is a system. It's no longer where an individual facility just services one community. Those days are gone. I think most people have realized that. So we really need to look at each facility, the role it plays, and how we can use them all collectively together to provide services. But our goal is to get it back up and running as soon as we can, but it is going to take time.
Having everything centralized in the city is, like I said, it's neat open, like I said, Connecticut is another, you get these places open, and all the nurses and doctors in Glace Bay actually live in the city. And now they're going to, like, the lineups in there is crazy. But the other people are not getting service for them in there. They just leave. It's crazy. You got to have it here also.
And that is our goal.
Glace Bay has a 40% poverty rate. A lot of people here can't get drive the city. These guys, gentlemen, are tied up for hours. They're not going to find out systems. It's not just from your government, it's from all governments, right?
No. It is, and can I just talk with you a little bit about immigration? Yes, so we talked about growing our own group, and I say all the time, if you have anybody in your family that's interested in healthcare, there are jobs, you know, we really need to look at our youth and encourage them to go in so that we can grow our own workforce, but we aren't really going to be able to catch up just through that model. So we've been working really hard around in-migration, so bringing people from across the country, and immigration, and looking at internationally educated graduates. So where are people trained in other parts of the country? We actually have about 200 Nova Scotians who are actually internationally educated graduates who need to come back in through a residency program. So working with the colleges, we've looked at how can we bring people to us more quickly in order to recruit, increasing the number of residency seats so that we can bring those Nova Scotians who have trained maybe in Ireland or Saba or places like that, get them home. And also look at folks who've trained overseas, how we can do a competency-based assessment versus just purely an educational-based assessment. So the Ukrainian nationals who've come here, as an example, have really challenged us because they don't have the records, right? We don't know what their education was, but when we look at their competencies, then they may be able to work in our healthcare system. So it's not just growing our own workforce. We need to look at how we can bring people in. And also, to your point around new graduates, how do we support new graduates? So particularly around nursing, it's very overwhelming as a new graduate to go right into a critical care area. So how can we work with the folks who are retired or at the end of their career who have a lot of experience to be mentors in our system in order to support those registered nurses and LPNs? And because what we hear often is that some of them will leave because they feel very overwhelmed in their work environment. So there's not just one thing. We have to look at a number of different ways. And I just want to assure you that all of those things are underway.
You're talking my language now. We're on that page, so just stay tuned on that. It's so aggravating, and of course you will know that Dave Dingwall's on a warpath too. So.
We have 3 doctors that are in Glace Bay, no doctors for the ones, but we're training them in treatment and putting in a residency.
That's right. And I know, and increase the residency seats to try and help get those folks, because those are the folks, especially if they're from Glace Bay, they say, I just want to come home and work, and they're not able to fully train. So we need to support those folks in order to fully train, because they want to come back home and they want to coach hockey here and they want to do that. So we are on that bit. It's a bit of a drag, it's a bit of a slog, but I want to assure you we're on it.
Just one more point there before we shift to the next question. I think the other point to make around emergency access of care is, and I think a lot of people would probably have heard this, is that a large portion of the patients that go to visit the emergency department are not actually there for a true emergency, right? So I think it speaks to primary care. You just touched on that, and I think the current government and our So it's about access, and how do we get patients the right access in a timely manner. I think we have an opportunity with some of the investments that have been made with unattached patients and access to virtual care. Great platform for a certain type of patients. And I know there's a lot of work that's happening in relation to try and secure more family physicians and expanding the collaborative practices to extend the ability of those collaborators. So I promise you there is work happening.
Thank you. There's a
Thank you. We're good now? Hi, my name is Nicole Morrison. I grew up in Whitney Pier, and I currently live in Coxheath. Can you hear me now? Yeah. Even with the microphone, I still talk too quietly. Story of my life. Anyway, my name is Nicole Morrison. I'm from Whitney Pier, but I live in Coxheath. These types of conversations are so important to me. That's why I made the drive out here tonight. So I'm a registered nurse and a mother and a community member and volunteer for different organizations. And I have two questions, if that's okay. I understand we're coming to the end of our meeting. And related to that is that I'm glad that you're here. I'm glad that you're going to 18 different places in the province. And thank you for that. But at the same time, that's not enough. We're going to need more time, more opportunities to have these conversations because they're too complex, nuanced. You need follow-up over time in order to really get to the root of the problem and work on solutions collaboratively. And I'm glad to hear that there have been conversations weekly, monthly. My first question is, are the people that are impacted by these decisions the most at those tables? So are the healthcare providers and our patients and patient advocates at these conversations ongoing and not just this one opportunity of 2 hours for the whole municipality? And then my second question, and I've had this for years, but I haven't had the opportunity to ask the right people. I'm wondering what the rationale is that we don't have more retention bonuses for our staff. And I can only speak from the nursing perspective. And because we're paying them money no matter what. We can't, like nursing is non-negotiable. We can't run the hospital without them. And so whether we can't run without nurses, and therefore they're going to be paying overtime costs or travel nurses to come in because we can't afford to have 0 nurses on the floor. So if we can find the money in emergency situations to pay overtime travel nurses, why can't we pay a higher rate, an hourly, like annual wage to nurses and the rest of our healthcare team, and also retention bonuses? Thanks.
Minister says that's my problem. So thank you. Thanks for that. And to be honest with you, this is a question that has come up at many of our sessions. So let me take your first one first. We do have patient advocates and community health boards and so forth. Not at every meeting, every time, but yes, they are. And also foundations. So foundations, community health boards, but we do have patient relations groups and patient advocacy groups, because at the end of the day, what's it all about? It is about the patient and the patient's family and supporters and so forth. So, it's an interesting point, because very often people will talk about our system being patient-centered, or patient-centered this, patient-centered that. But I personally find in many cases that's lip service. So it's very important to make sure that that hat is on and the questions being asked. So I appreciate that, and I can assure you that there are many views that are taken into account. On your second question, it's we're heading into, I mean, this is not there's no surprise here, no secret, heading into collective bargaining with, among others, our nursing group. So, you know, what I've said in previous sessions is that Nova Scotia is the largest of the Atlantic provinces. We have the largest population, and we have the largest number of healthcare workers, and we have the largest teaching hospital, and the largest regional hospital. So in those circumstances, we have many healthcare workers with not only years of experience, but, you know, deep experience, and they should be compensated very fairly with all of that in mind. So I look forward to that, and I hope that coming out the other end, there'll be a good, positive result. In terms of retention bonuses, I share that I have a niece who's, I guess she'd be 26. She's a second-year nurse in Halifax. So I regularly hear, mostly by text at 2 a.m., 3 a.m., Karen, they did this in Newfoundland, they did this in Prince Edward Island, they did this in New Brunswick. If I go travel nurse, I can do this. If I move to Texas, I can get this. So I actually thank her for making sure I'm in the loop. And I worry about the travel nursing a lot. So in the case of, you know, my niece, she's footloose and fancy free, so she can go to Texas, she can go on a cruise ship, she could be a travel nurse wherever she wants. And it's very hard to compete dollar for dollar on the travel nursing, because in part that's a lifestyle choice. And I would understand a young person who wanted to go do that for a few years and then come home to Nova Scotia, perhaps. So we're competing. And I think part of what we have to do, yes, it's on the pure compensation side, but it's also lifestyle and also work-life balance. Like, we have to get ourselves to a spot where nurses and other, I want to be careful because it's not just nurses, but our healthcare professionals need to, they need to feel valued, but they also need to be getting breaks, because it's so intense and so difficult. So finding ways that we, you know, can put a bit of a rotation into their job, so that even if it is 12 hours, maybe they do a week of this, a week of that, so that they can get a bit of a break in the course of a week or a day or a month. So these are the kinds of things that we are looking at. It's not really a full answer to your question, but I will tell you that everything you've said is definitely on the table at our discussions. And so it's through conversations like this that we can hear from the front line and from members of the public as well, in terms of their interaction with you. And I appreciate you coming over here tonight, and thank you.
And if you have ideas, you can email Karen. That's what she usually says. I was waiting for her to say it, but like, if you work in a team, I'm not sure what your work environment is, but if you do work in a team or a unit or whatever, and you sit as colleagues, I do think money's part of it, but I do also think that it is around work-life balance, and it is around opportunity. You know, how do we support people in terms of, you know, things that are important to them, and make sure they feel valued. And I think you probably know, we need to be really careful when we try and show people that we value them, that it's not tokens. Right? So if you have ideas about what you think your team would you know, make you happy, it's helpful for us to know that. So you can email Karen. Yeah.
Oh, and they do every day.
Everyone does, yeah.
They do. So we're getting close to end of time, actually, but I know we have 2 questions, I think, left here and here. Oh, sorry. Yes. Okay, so we're going to get quick ones, hopefully.
Short snapper.
Short snappers? 3 short snappers in the end? Hope, maybe?
No, I waited all night to ask this
I
question.
know, I gave you a chance earlier, though.
It's for Minister Thompson. I know about you. I came here because you're here. You know what I mean? I'm a third-generation coal miner and very proud of it. My grandfather moved here in 1890, and I've lived in Glace Bay, the same area all my life. The coal mines gave me bad lungs and broken bones. But as a young man, that's where you went when you lived around here in those days. In those days we worked. My passion now, the last number of years, has been clean water for children to fish in this area. We've had that since 1967, when number 20 dam was made of put and take lake. Over the years, it's been destroyed by an arrogant regional government. I don't want any answers from anybody but you, all right? I'm not interested in the BS. I've been here since 2 years. Here's the problem. I dealt in safety all my life. I worked with Labour Canada, and I was in charge of safety for Phelan Colliery and for 26 over engines and men and rigs. I didn't tolerate lack of safety. We have a body of water called 20 Dam that was pristine. It's now toxic. We were told not to test it. George and I had to gather up the money ourselves. Nobody gave it to us, and we tested it and found out how toxic it was. Marine biologist Stephen DeBow for the province said it's a petri dish. Name of God, what's going on down there? There's 17 drainage pipes going in. Our MLA doesn't mention the drainage pipes, but they drain street sewage into this put and take lake where I am asking children to sit down and fish. This water's been contaminated and poisoned since 2 years, and the regional will not post a sign. We have a charter from the province, and you don't pick up the phone, you get a charter. And on the charter it states, clean water for children to fish in once again, and a clean environment for the people of Glace Bay that live around this area, that use this lake as a fishery food. There's a lot of people around here with nothing, and they were fishing there, take a fish, eat. Now, in my opinion, for my MLA not to act on this and skate around it is insulting to my intelligence for what I have left. Now, this is a hazard to the public. It has to be posted before somebody falls in a hole and doesn't get out. Do you understand? That's where I'm at. I'm worried about this, and I'm scared people are going to get hurt. And there's nothing been done since 2 years. This is ridiculous. That's all I got to say.
Thank you.
Okay, thank you. So I know that, I think you had a question early on in the evening, so we'll get to you and then.
Hi there. I was approached by a friend just as when she found out I was coming here to ask a question about the blood bus. I was not aware of the blood bus. Apparently, in Sydney, you can donate blood on a bus. And now there's no Red Cross in Sydney where you can donate blood. The problem now is it's located in Port Hawkesbury, and it's very hard for people to access it. So there you go. I mean, it's a very important issue. Anybody wants to donate blood, and regular people that donate blood are the ones that ask me the question. And I couldn't leave here. I wouldn't be allowed to go home with such an expert panel up there without asking it.
Okay.
So
now we got to get you an answer.
I need an answer.
Okay, we'll
let's
just
find
give you-
one.
Does anyone in the back
know
the
about
answer?
the blood bus?
Does
'Cause I
anyone-
don't.
Yeah. So what I'm going to have to do, we will get you an answer, but Canadian Blood Services is actually the organization that collects blood. And so what we need to do is to reach out to them, and we're going to, did you have an email address? Okay.
Well, we'll get your name and number.
We're going to get your name and number, so we have to call them to find the answer. And whether it's a mobile unit, now I know sometimes they have blood donor clinics at the universities. So we'll find out a little bit more about that here, and we'll get back to you. But you're going to have to tell them it's not your fault you don't have an answer. It's my fault, and they can't be nasty to you. Okay? All right, you tell them. Okay.
Okay. Okay. Yeah. So I do have we. Okay, email Karen.
Or just talk
That's
to
the
me
thing,
after.
right? Yeah.
Just talk
So-
to me after.
Okay, so thank you very much, everyone, for this conversation tonight. And I know that I'm always in awe when we do these sessions, both of the people that come up and are brave enough to share their stories and to ask the questions that are hard to answer, and to this panel that comes up and answers the questions as best they can and finds the information when they can't. And I know that they'll get back to you. So if you have questions that we haven't gotten to, I am really sorry for that. But please write them on the card with your email or your phone number, and someone will get back in touch with you with the answers. And thanks again, everyone, for coming, and please have safe travels home. Thank you.